My name is Paul Wisdom. I'm the machine and fabrication specialist here at the Proton Center. And we have an on-site machine shop. We have 4 men working in this shop. Basically what we do is we take a plan that the Symmetry sends to us, and we actually program that plan and produce a program that will run on our CNC machines, and we create the compensators and the apertures for each patient-specific device. The compensators are pretty much just they're the acrylic device that forms, I would call, the 3D image of the tumor, and the aperture actually creates the shape of the tumor, and the aperture is the brass portion. Most of the compensators we try and run at night just for the noise level. We can run some of the prostate compensators during the day, and sometimes if we have to do a quick turnaround, then we'll have to go ahead and run it during the day, and we just put earplugs or use headphones to help deaden the noise a bit. And so we can run at night, we can run up to 8 medium devices without, pretty much lights out, because we can push the button when we leave in the afternoon and they'll run those. And they might run for 6 or 7 hours at night till all the devices are run. The apertures, we can run probably, I would say 40 or maybe 40 to 60 a day if necessary. They average run take approximately anywhere from 5 minutes up to 15 minutes or so to run an aperture. We don't really have to have special training in really just have machine shop background and have a machining background to come in and be able to run the machine. The process that we use is fairly specialized. Most people in the machine shop don't have the background as far as the programming, so we have trained each person individually to where they can program the devices, and then the machines themselves. Most everyone has some experience running this type of equipment. There are a number of QA operations that go on. We can look, and as we're processing the compensators and apertures, we can actually use the software, and it has a rendering portion that we can actually look and tell if it's going to machine correctly. And then after, we print out a QA sheet that has 6 points on it, and we have just coordinates, X, Y, and Z coordinates, and it will produce 6 of these just at random. And then we check those points and write it down. So then the physics department comes in and they check those, and they use an overlay on the apertures and the compensators, and then to verify that, and then they sign off on these devices.